Thanks again, everybody, for joining us today at our first of 3-day session on sponsor influences on the quality and independence of health research. My name is Aaron Kesselheim. I'm a physician and lawyer and a professor of medicine at Brigham and Women's Hospital at Harvard Medical School. I have had the pleasure of helping organize this event with the rest of the organizing committee, and thanks for Lonnie for introducing the session at the beginning of the day. I think it's really important that we're talking about these issues, and it was great to hear from Lisa Biro to understand the scope of the problem that influence on research can have. And I think you don't have to go any further than looking at the New York Times or CNN to understand the impact that research that is unduly influenced by the sponsor can have. We have a daily struggle with trying to figure out what is useful information, and right now has a lot of issues with trust in what comes out of the scientific enterprise. So it's really important to keep an eye on these issues because they can have substantial impacts on those beliefs in the science that comes out and the uptake of it. So the focus of the rest of today is going to be on the protection of research integrity, and we're going to hear from a number of different speakers with perspectives on how research integrity is upheld. Our first speaker today is Dr. Patricia Valdez, who is the health policy science analyst at the National Institutes of Health, and an extramural research integrity officer at the NIH Office of Extramural Research. Her full, very impressive bio can be found online. So I will just turn the floor over to Patricia and let's hear about what the NIH is doing in this area.
Great, thank you so much, Aaron. So I'm happy to be here today to talk about research integrity and extramural research at NIH. I'm going to focus on some of the steps that NIH has taken to help to reduce bias, either in the selection of projects for funding or in the conduct of research. Okay, so I don't have any relationships to disclose. And today's topics are going to be on rigor and transparency in applications, avoiding bias in funding decisions, allegations of research misconduct, financial conflicts of interest, pre-registration and reporting of clinical trials, and NIH data management and sharing policy. There's a lot of things, but I'm going to hopefully get through all of them in my 20 minutes. Okay, so first I want to talk about rigor and transparency in applications. Now, around 2016, even before 2016, a lot of attention was paid to the problem of the lack of reproducibility, and in particular in preclinical data, where pharmaceutical companies were trying to reproduce some of the data that was in publications. And so one of the things that NIH decided to do at that point was to implement this policy called enhancing reproducibility through rigor and transparency. And so the idea of this was to basically get researchers or applicants to describe their research in more detail and how they're going to produce rigorous research, and then also allow the reviewers to comment on that and to make really more better assessments of how rigorous the data are. So there were 4 areas of clarification. One was rigor of the prior research, so how rigorous was the prior research that this new project proposal is based on. And the second piece was scientific rigor of the proposed research, and I'll talk more about that in a second. That's really a lot of what we're worried about. Number 3 was relevant biological variables such as sex, and so we wanted to make sure that that researchers paid attention to the effect of sex on their studies, in addition to other biological variables. And then authentication of key biological and or chemical resources. And here we were worried that, and what we were seeing was that there was problems in several different types of areas. For instance, cell lines, individuals were using cells that were misidentified, and therefore the results could be questionable. So getting back to scientific rigor, so we define it as a strict application of the scientific method to ensure robust and unbiased experimental design, methodology, analysis, interpretation, and reporting of results. And so in the applications, we asked that the applicants describe the experimental design and methods proposed and how they're going to achieve robust and unbiased results. And so here, we asked them to provide more information about, how do they calculate the sample numbers, and what are their analytical plans, and so on and so forth. And I just wanted to point you to our website. This website is our Enhancing Reproducibility, the Rigor and Transparency website. And there's a lot of resources here, including examples of authentication plans, examples of rigor in applications. There's also this handy infographic, which really points out, again, the 4 areas that we were concerned about, that were changed or clarified in 2016. It also has the reviewer questions. So what, number 3 here, what are the reviewers asked to score or asked to consider when they're scoring applications? So this is very useful, I think, for people to take a look at. So that's the conduct of the application itself. What they really want them to describe. How they're going to produce unbiased and rigorous research. Okay, so then the next thing I want to talk about is how we avoid bias in funding decisions, and I want to talk about how the NIH decides what research to fund. Now, this is an infographic taken from the National Cancer Institute, but it's really relevant to all of NIH. So let's see, hopefully, I hope this piece isn't blocking this graphic. But okay, so in the top, you see here's the principal investigator. This is the person who will conduct the research, initiates the research ideas, and prepares the application. And then we have the grantee institution, so or the university here. And then on the bottom here, you have NIH. So again, you have the application comes in, the grantee institution or the recipient institution will submit the application. Once it comes in, the CSR, the NIH Center for Scientific Review, will then assign that application to a particular study section. And again, this is specifically referring to NCI, but this is relevant to all NIH. So the application gets referred to a particular study section. So then there is a scientific review group that will evaluate the application for scientific merit. So this is, evaluation of the research by the applicants or the PI's peers. And so this group will provide scores for the application. And one point I want to make is this is only one step of the peer review process. So there is an additional step that's then taken. So once the scores are put in, then the next step is that the second round of peer review is now the advisory board, advisory council. So this is a council that will advise the institute or center that wants to fund a particular application, whether or not this is a good idea, whether they agree with this, the way forward. And so this acts as an additional, safeguard to think about, making sure that we're making the correct funding decisions. And then, so after the advisory committee or advisory board recommends action or recommends to fund, the NCI or NIH evaluates the program relevance and need. And then we will make funding decisions and issue the grant awards. And then NIH will monitor the programmatic and business management performance of the grant. And as I mentioned before, in the application, we ask for information about rigor and transparency. And then also in progress reports, the yearly progress reports, we additionally ask for information about how the applicant is ensuring robust and unbiased conduct of research. And then go on, again, so then the Institute manages funds and so on. So this is a circle of the funding, the grants process. So there are several core values of NIH peer review that we hold dearly, and we share this with all of the review staff and our reviewers. And so they are, number 1, expert assessment. Number 2 is transparency. Number 3 is impartiality. Number 4 is fairness. Number 5 is confidentiality. Number 6 is security. And number 7 is integrity. And number 8 is efficiency. And so I'm going to focus on these 2 pieces, impartiality and integrity, today. So as far as impartiality and peer review, so that refers to the management of conflicts of interest or the appearance of conflict of interest. And as was discussed earlier, this doesn't only mean financial conflict of interest. This is something that reviewers must certify their COIs pre and post meeting. And in addition to the peer reviewers, we have special government employees and the council members. These individuals who serve on the advisory council or boards adhere to the standards of ethics for federal employees. So they're acting as federal employees in that role. And then, we do restrict lobbyists from serving. And then we also have a separation of NH staff functions. We have this NH staff that serve in peer review and then NH staff that serves in programs. So not the same person who is overseeing the conduct of the research year by year is not the same person who selects or helps to kind of not select the peer reviewers, but I guess they select the peer reviewers, but they help manage the review process. And also, if an individual has concerns about maybe bias of a peer review, we do have policies for managing those appeals if they want to appeal the review of their application. Now, what about integrity in peer review? So we do have our staff is trained on how to handle allegations of research misconduct and other types of allegations. I'm focusing on research misconduct here. And so reviewers and the council members are, before each meeting, they're instructed to report the allegations, any allegations that they have directly to the designated federal official. In the case of reviewer, usually it's the SRO or scientific review officer who's in charge of the meeting. The designated federal official will then report that allegation to the assigned research integrity officer who's at the different ICs. And then at that point, we may decide to defer the application from review until we've had a chance to look at the situation. And then once we assess the allegations, again, it's all done confidentially, we will then refer the allegation to the HHS Office of Research Integrity, who has responsibility for oversight of research misconduct investigations. So now let's go to allegations of research misconduct. Now, allegations come to us many different ways. So many of them come through peer review. During peer review, we also get some that come from outside of the NIH, or RI can let us know, institutions will let us know. So many places we can find this information out. One point I want to make here is that in addition to research misconduct, our office also handles a lot of different other integrity concerns that can affect research. That includes harassment. This can be sexual harassment, bullying, discrimination, grant fraud. So grant fraud will actually be referred over to our Office of Management Assessment for potential referral to the Office of the Inspector General. Then we have foreign interference, which has a lot to do with disclosure. And then we have peer review integrity, where we have individuals trying to breach the integrity of our peer review system. Now, so we have a system that we use to collect our allegations. We conduct an assessment, and then depending on what the outcome of the assessment is, we may take a couple of different actions. We could contact the institution. We could remove an individual from serving in peer review. We can refer it to the agency or office with oversight. For instance, for research misconduct, we would refer that allegation to ORI. And we can also take some administrative actions, which I will talk about in a little bit. And then also there's regulatory actions that we can take against institutions in more serious cases. And just a general overview of the research misconduct proceedings, I'm going to go over this very quickly. So we have the allegation comes in, then there's assessment. An assessment is conducted by ORI or the institution. They ask these questions. Is the NH funds involved? Is it credible, specific? Does it meet the definition of research misconduct? And then the institution will conduct an inquiry and then an investigation, and then provide the investigation report to ORI for oversight. Now, NIH can become involved at any step here when it's determined that there is a risk to the funding, to the research, to human subjects, to animals that are involved in the research. And so we can take some interim actions for integrity concerns. So we really want to protect the public, research participants, the research process, and public funds. So some of these interim actions include, but are not limited to, specific award conditions on grants. So we may require additional supervision of any individual that is involved. We could require the certification of data if we're told that the raw data were not being kept, for instance. We could request a change of PI. We could restrict funds as needed, or we could suspend or terminate the award. And in some cases, we can refer the case or the individual to the HHS Office of the Inspector General. Okay, so financial conflicts of interest. So many of you know about. So this is our policy is based on the HHS regulation 42 CFR Part 50 Subpart F, called Promoting Objectivity in Research. And so this regulation establishes standards that provide a reasonable expectation that the design, conduct, or reporting of NIH research will be free from bias resulting from any investigators or conflicting financial interests. And so the way this policy works is the investigator or the researcher must report their significant financial interests to their recipient institution. The recipient institution will assess that SFI to determine if there's a potential financial conflict of interest with the NIH work. And so if there is a potential financial conflict of interest, they will provide a management plan to NIH, and NIH will decide to approve it or not approve it. And so that's one way that we do help to manage the financial conflict of interest when it comes to the researchers in the extramural community. Okay, and then registration and reporting of clinical trials. I just want to briefly mention this. So several years ago, we published a notice, and some of the regulations are listed here on the bottom right. This involves the dissemination of NIH-funded clinical trial information. It requires pre-registration and then dissemination of the actual research results, the data results of the clinical trials. So again, all NIH-defined clinical trials, they are required to register and report the results in clinicaltrials.gov. This is regardless of the study phase, the type of intervention, and it's also subject to regulation. And here, this is a link to, hopefully the slides will be shared, but this is a link to our grants website regarding clinical trial registration and results reporting. So the policy requires that there be a plan in the application that outlines the compliance with the policy, and this will become part of the terms and conditions. So if an institution does not follow the plan, they can actually become in trouble. We could potentially terminate an award or take regulatory actions against an institution. There must be a statement in the clinical trials consent forms that discusses the posting of clinical trial information at clinicaltrials.gov. Again, they must register in clinicaltrials.gov no later than 21 days after enrolling the first participant. And they must report summary results to clinicaltrials.gov no later than 1 year after the primary completion date. And again, so the pre-registration, they have to provide information. And so the idea is that once they do come in time to report, that they are reporting on the same outcomes and primary outcomes that they were planning in the beginning. They don't change those things. Okay, and the last thing I want to talk about is our scientific data sharing policy. So this actually goes into effect next month. And so this is a policy that was developed, this took many, many years to develop. And the idea behind this is that we want to make sure that we're using public taxpayer funds, and the researchers are using public taxpayer funds. And so we want to make sure that the results are freely available. And that includes, not only the, positive data, but including negative data as well, because as was mentioned earlier today, some of that negative data is important. It's important to know. And so this is something that, we thought long and hard about, and we are working with the extramural community to make sure that, we do have proper plans in place and proper places for storage of that data. And we think this will be a very positive step going forward. Okay, well, that's it. I covered that very quickly, so thank you.
Thank you, Dr. Valdez. That was very very useful overview of a lot of different work that NIH is doing. Are there any questions that anyone has? Any clarifying questions that people want to ask at this point? We'll have some time at the end to talk with all of our speakers. Okay, so we've got another minute before Daniel Greenbaum is supposed to talk. Maybe I could ask whether, you talked about a lot of different aspects of ways that NIH oversees research integrity, and the focus of the conversation today and over the next couple of days is about the sponsor's influence on research itself. And so maybe you could highlight which of the various different methods of oversight you think are most directly relevant to protecting the independence of the research itself.
Yeah, I really think the peer review portion and the fact that we had this two-prong peer review really, we're making sure that we're selecting selecting applications not based on the NIH individuals at the NIH, but really it's their peers who is selecting the best research to fund. When you talk about the influence of funders, one interesting thing that we're seeing more and more is that, we're seeing individuals that are citing NIH funding in their publications inappropriately. So where they are not actually supported by NIH, or the project was not actually funded by NIH. And one of the reasons that they do this is so that they can get that particular paper put into indexed in PubMed, which provides legitimacy to that research. And so that's another problem that we're seeing as well. But I think overall, just making sure that, we are taking the best steps that we can to make sure that we reduce bias in all ways is important.
Great. Thank you very much, Dr. Valdez.